I always tell our people, start walking when you have 60% of the information you need. If you wait to reach 100%, you will never have a product, but someone else will.
Today, I am in Zug, joined by Ulrich Faessler, CEO of SHL Medical. SHL Medical is a leader in designing, developing, and manufacturing drug delivery solutions, especially auto-injectors. We will talk about the future of healthcare, about Ulrich's leadership, and about the challenges the world faces at the moment. As a leader, what's most important to you in terms of leadership traits, and what do you expect from other leaders in the company?
To be authentic is in the core. When you're authentic, you're more true to yourself, and your environment will see that. It will reflect. Then, of course, listen, but not listen to respond, listen to understand, so you can support. Having this entrepreneurial spirit that, moves companies much faster forward instead of just being there to do the job.
The times of change can be taxing for organizations. How do you help your employees to maneuver through these times of change?
We say always listen attentively, think carefully, and then act boldly. And that's SHL in a nutshell. So we listen to our customers, we listen to our stakeholders, employees obviously. We think, interpret, but then we act very bold. And I think that's still a difference compared to other companies, how we operate.
Another thing that changes is AI, and especially AI in manufacturing. How do you think about the opportunities, and what are you doing to address that topic?
And then in 2020, we started to digitize the company end-to-end, right? And so now talk about AI, you need data, otherwise AI can't really do much for you. So we created with that digitalization of all the processes, we created enough data that we can now use to bolt on AI into different areas in the business. We started actually with root cause analysis is fully driven by AI already. And we have identified now many other areas that we are going to step-by-step address with agents. So our people can benefit from, or not do any more work that can be done easily by an agent, by a bot. Right?
How did your people react to this digitalization? There is often some defensiveness around it. Were they open to it, or how did you manage that?
You see both. First, not too open actually. That's the first reaction, because they don't know what it means for me. They don't know, some people think like, my job is gone, but that's not the case. I drive it actually from top down, and I've seen that in many other areas like the digitalization, and of course we have also bottom up. I want to see the ideas that could move the company forward quite fast. I always tell our people, start walking when you have 60% of the information you need. Then while walking, you increase to 80%, and then it's about what you get. And that's where you start to build your vision on, or your product, or whatever it is. And while you're then building, already working on the real product, you increase to 90% or 95%, more you won't get. If you wait to reach 100%, you will never have a product, but someone else will.
You're the market leader in your space. What keeps you going? What excites you to define the next chapter?
So first of all, we are very proud. We just recently had the 1.5 billionth device that was used by a patient. So that shows that what we are doing has an impact on the industry, but also on patients' lives.
If you think of SHL Medical in 10 or 15 years, what is your vision of the company? What will have changed?
So I will just start with what will not have changed. We still remain number one in 10 years. But what will have changed is, first, we will have a fully functional global footprint that, as we call it, closed-loop manufacturing. So we can manufacture all products anywhere at any point in time. Secondly, we will reach a bigger patient population, through the global footprint. So today is more in the Western countries. We will then have also addressed the emerging markets. And then third, we will have products that will have emerged from only doing an injection to also have closed loop feedback that will help the industry and physicians to have a more effective therapy for patients.
Thank you so much for being here.
Thank you for having me, Torben.